Hi, Jambo, it's your Jomba Mobili Mogodi. I am here at Kenyatta National Hospital, where nurses have announced a strike since morning today. I have managed to speak to a few officials.
Kwa majina naitwa Linus Khasenye, muuguzi katika hospitali kuu ya Kenyatta, na pia mimi ndiye katibu wa kitengo cha chama cha wauguzi hapa Kenyatta.
My name is Kagwiria. I'm the branch secretary, Kenyatta National Union of Nurses. Treasurer.
Our grievances are mainly about 5 or 6. One is non-remittance of third-party deduction, in that when employer processes your salary, they make deductions for those commitments that you have taken, you have committed yourself to, like bank loans, loans, shares or savings, welfares, union deductions, association deductions, insurance premiums. They are deducted from our payslips. But after the deductions have been done, they are not submitted where they are supposed to be remitted. So remittances are not done. Number two, there's a return to work agreement that union signed with the government and KNH inclusive in 2017, which was affecting nursing service allowance to be improved from 20 to 30,000. Nursing service uniform allowance to be improved from 10 to 25,000 since 2017. It has not been implemented. The other thing is delayed promotions of our colleagues. We also have a problem with our medical cover. We are having internal medical cover where you are treated within KNH and KNH settles the bills. But what happens is that when you are sick or when a nurse is sick, he goes to the clinic, there's no medication. He goes to the clinic, he cannot see a consultant or a specialist, or some drugs that are classified like that you are not supposed to access. You access lower cadre medicines. So we are finding it to be unfair to our members. We have been engaging management on these issues since last year, May. The issue of return to work agreement of 2017. We had engagement from May. We were sent to a conciliator. We went through the full process. Conciliator did his report. The agreement was forwarded to SRC. SRC objected and returned to the management. So up to today, that agreement has not been implemented. CBA negotiation, management is dragging their feet. The CBA negotiation is supposed to be at 2025 to 2029. Up to now, we have not negotiated that CBA. The first year of CBA is almost over. So we are feeling the management is dragging their feet, and they need to hasten the process. The issue of promotion, I understand the CEO was talking about a new HR instrument. But promotion is a normal thing in the employment. We have an HR instrument which is running, so we expect the CEO to use the old HR instrument to promote our colleagues until the new instrument is in place. I think that is much that we are crying for today. And our colleagues, we also have our colleagues who have been on contract for some time. And the management has kept on dodging and postponing the absorption into permanent and pensionable service. So we are urging the management to handle these issues with urgency that they deserve before our members resume their duties.
Okay, so how long do you plan to go with the strike?
For as long as our issues have not been solved, especially the issue of remittances, the issue of medical cover, and the issue of promotion, the issue of absorption of our members, and lastly, the issue of remittance of third-party deduction.
Okay, sir, but are you willing to go to the table and discuss and negotiate with the stakeholders involved in this whole scenario?
Like I've said, we have been in engagement with the management for as long as it has taken. And we are still willing, but we don't want to be taken in circles. So what we are putting on the table is that we shall come to that table while our members are out. And we shall only request our members to go back after we have gotten a substantial agreement and signed by the signatories. Yes.
What will happen to the patients in here who may need your services?
We are always considerate of our patients. We know that we have an oath to serve our patients, and we are professionals. We have placed a mechanism in place, or we have put a mechanism in place that a few nurses have been left in critical areas like ICU, newborn unit, labor ward, just to attend to those critical issues, cases that need emergency care. Thank you.
Do you have anything else to add?
Thank you very much for coming over. We are grateful. Now, my name is Purity Kagwiria. As I said before, we have been arguing this over and over. We have spoken about this for quite a long time, like my colleague has said. We have been expecting fruits, but we have not been getting any. It has taken a long time before KNH nurses decide now we are going out. From 2017 to 2026 is 9 years. From last year, May, to now is almost 11 months. Surely, someone needs to listen to us. When we say our third-party deductions are not done, how are we supposed to settle our bills? If I have money that is deducted from my salary for my loans, and you don't remit it, the money that will go from as my salary into the account, it will be taken by the bank. I am left negative. How do the nurses of KNH get to feed their families, pay their rent, and have their every other day bills settled? Therefore, it is very hard for us to come to work because if at your fare, so we need to be listened to. We need the government to pay our bills so that we are also taken care of. Now, we also need cover that is equivalent to our status. We cannot be treating and we are not getting equal treatment. Let us have a medical cover that is going to be across all the staff. If the nurses are not getting the clinical care they are giving, it is also not going to be very good. If you can't get medication, you have a formula of which medications you're getting, it means someone is sidelining you. So let's have equity. Just like the values of KNH are, one of them is equity. Let's have equity in the care we are giving and the care we are getting.
I have another
Thank
question.
you.
Kenyans are also concerned about the issue of SHA payment, of hospital payments being made to 3.2 and then not going back to hospital, affecting equipment, affecting service delivery. What do the nurses have to say about these working conditions?
I will say from the nursing perspective, from the union perspective, I cannot speak on behalf of the hospital. From the union perspective, we would want to have tools of work, then we'll give better care. We want to have nurse-patient ratios improved. We cannot have nurse-patient ratios of 1 to 35. It is not acceptable. 1 to 20, it's not acceptable. In ICU, 1 nurse to 3 patients, it's not acceptable. We need to have good working ratios so that we give professional care. Thank you.
Do you have anything else to add?
My name is Pamela. I'm a nurse here. I'm the organizing secretary of this branch. My colleagues have said it all. The only thing I would maybe pass over is about the arrears. You know, if you have a loan with the banks or circles, they always have interest. So if you don't pay, they accrued interest. So I think it will be better also if our CEO would tell us who will be paying who will pay for these arrears, loan arrears. Yeah, and again, we as Kenyatta, if I don't say maybe nurses alone, Kenyatta at large, we've been on our toes all year in. The last time we were out, like today, those are how many years ago? Many, about 8, 9. You see our neighboring counties hospitals, they're always out on the street strike, as we are always here. So when we come out like today, it is not just a simple matter. Yeah, it has taken us time just to sit and figure out about it and how we can handle it. But our management is not able to sort our grievances. So that's why we are out, and we are praying that by tomorrow we would have come up with something. Yeah.